Welcome to our panel today. All right, so I'd like to start out with focus on the high-level view. Each of you are performing a critical function in the EHRM modernization space. So can you provide a brief summary about the efforts you're involved in within each of your respective areas, specifically covering what role you and your team play in those efforts? Who would like to start?
I'll go ahead and start. Okay. Go ahead, Justin.
Go ahead. Sorry.
All right.
Hi, good morning, everybody. Justin Meyer, again, Deputy Director of Acquisition Programs here at the Coast Guard. Really, my role is supporting the Program Executive Officer and providing kind of programmatic and oversight to all of our programs across our three domains, the surface, air, and C5I domains, and really reaching across the Coast Guard enterprise in general to provide technology solutions to meet the Coast Guard's needs. And really specifically in relation to this, we've recently rolled out both the electronic health records and a telehealth solution, which has been really helpful for supporting our men and women across the Coast Guard.
Thank you. Dr. Thompson?
Thank you. So I'm part of the Federal Electronic Health Record Modernization Office, the firm, and you all heard from Bill Tinston a little while ago, who spoke quite eloquently about what we do in the firm. So I won't belabor that, other than to say that our role in the firm is really to work collaboratively with our Department of Defense, Department of Veterans Affairs, and U.S. Coast Guard colleagues to ensure that as they are deploying the electronic health record, we're aligning around common standards, common capabilities, common configuration sets that are being deployed into the clinics and medical facilities. So I serve as the Director of Commercial and Federal Interoperability with the firm. And our role really is to ensure that the exchange of data is seamless. As Mr. Tinston mentioned previously, a lot of our work was focused on the ability to exchange data in a seamless fashion across the DoD and the VA. As we move towards a common record, it becomes much more about ensuring that we're able to exchange seamlessly with providers in the private sector who provide community care to all of our beneficiaries. So that is really our focus, and we work closely with the private sector, standards development organizations to ensure that we're aligning with the standards that are being set across the industry, where we work quite closely with Department of Health and Human Services and the Office of the National Coordinator for Health Information Technology and other federal agencies as we fulfill that mission.
Great, thank you. Christina?
Hi, thank you for having us on today. My name is Christina and I'm with DocuSign, and DocuSign is a company that we are considered the leader in an e-signature solution, but we also see ourselves much more than that. We are really a leader in digitizing agreements. We believe that the world is run on agreements. Every agreement needs to be signed, prepared, acted on, and managed, whether we're talking about a patient consent form all the way to a contract that you might have with another agency. Agencies, our federal government spends around $38.7 billion on paper-intensive manual processes. That DocuSign has come as a solution, particularly in this COVID-19 era where people have to be more remote and face-to-face contact needs to be limited, that we have become a critical solution to the public and private sector as a solution to help with this issue. We've seen a huge demand for our services in healthcare. So I help manage the healthcare vertical for DocuSign, and we've seen this solution be adopted across states such as New York, federal agencies such as the DoD and the VA, significant providers, pharmacies, behavioral health, mental health, fertility clinics that need more stringent identity verifications, to our SNFs and elderly care facilities where we need, and home health. So we've seen that the VA has used us for vaccine consents, The DHS for the U.S. Air Force Academy has used us for those mental health counseling services for patient consents and Hipaa releases. And a major provider, Houston Methodist, one of the largest providers in Texas, launched us in less than 3 months, and we sent over 10,000 packets to be able to fast track these patients where they could just get a bracelet and go straight into their procedure and not have to wait in their waiting room. So as you can see, our role is very vast, it's very broad, and it's all about helping our customers and the agencies really meet this moment with COVID.
Thank you. That's great to hear. Now, each of you touched on the topic of collaboration and working very closely with others and the importance of that. And, lack of collaboration, specifically interagency collaboration, has been a huge challenge in the past, right? In fact, I'd venture to say that it's probably been the prime stumbling block in previous failed modernization efforts. So as you're working to roll out critical initiatives, how do you achieve effective collaboration, coordination, decision-making across the varying stakeholders, each, of course, with their own timelines, agendas, goals, priorities, et cetera? Dr. Thompson, how about we start with you?
Sure, thanks. Great question. It is always a challenge aligning the interests of multiple federal agencies and stakeholder groups. But let me just say right off the bat, our focus is really on ensuring seamless care to the patients and making things as easy as possible for the providers. So what is really critical is governance. Having a well-articulated, well-structured, well-functioning governance process that allows collaboration, that has rules for how we make decisions in an interagency environment. And that is a lot of the focus of what we're trying to do in the firm. We've developed a number of governance bodies that work collaboratively across the departments. We have a joint functional decision group, which is comprised of the subject matter experts, the doctors, the nurses, the ancillary folks, who all come together to make decisions jointly on functional matters that need to be decided for the EHR. We have a joint sustainment and adoption board, which we call the SOB, again, which is a collaborative group across the departments that the firm is facilitating that makes decisions jointly on configuration changes and changes to the commercial baseline that is the foundation of what we're deploying across the departments. We have a technically oriented body, which we call the Enterprise Management Operations Center, that makes decisions jointly on technical matters relating to the federal enclave, which is hosting the software. And again, as I mentioned before, in the interoperability space, we work quite closely with a broader group of stakeholders across the federal agencies and with the commercial sector. So I would say the key to it all is keeping the goal in mind, which is providing the best care to the patient and servicing the providers, and doing so in a governance construct that's very well articulated and operated.
Great. Justin?
Yeah, sorry. Yeah, no, I think that 100% on board with that. I think having that clear and concise and universal goal of focusing on the end user and how we're going to get the best product out, I think has been great and really a cornerstone. We can't over communicate. I know that Admiral Schofield, my boss, and myself had regular interactions and discussions with Bill Tinson and the others at the firm and across CHA and VA, as well as ensuring that leadership alignment and understanding and really becoming an active stakeholder, I think has been really successful, or made a large part of why we've been so successful to date and will continue to be so. But that singularity of purpose, I think, is hugely beneficial.
So I think from DocuSign's perspective, our view is really about velocity to delivery. So we put a team together at DocuSign, which is our customer success managers and our architects. We invest a lot in this internal resource that works collaboratively and closely with our customers. And so we really work over the weekends, or we help along their whole journey. We like to call it a transformation journey, where we really set out those goals at the beginning of where we're at and then where we want to go. And we try to create these centers of excellence, where it's this not bipartisan, but this very diverse group of senior leadership, but advocates, and also IT. We find the main stakeholders to be finance, IT, someone that's really focused on the patient experience, and an advocate that can just open doors when challenges happen. We've also seen that in light of COVID, that there's huge urgency. So from our public sector side, the New York State Department of Labor had a huge critical backlog of unemployment claims that they just couldn't get through to distribute payments fast. And so within 5 months, DocuSign was able to help them send over 3 million envelopes. And within 4 days, we were able to get this live because of that need of that the New York State Department of Labor saw, and really came together around this and around DocuSign to implement a technology to be able to be successful. On our side, our team had professional services, engineering, technical customer success, customer support, sales, solution engineering, product. So it really is a collaborative process. I would say another interesting anecdote is our work with the HRSA, the Health Resources and Services Administration. They were able to deploy DocuSign, their provider disbursement portal, over a weekend. And that was able to help distribute over $30 billion in emergency funding. And then lastly, just to highlight again, collaboration that's happening more on the private sector side was our work with Houston Methodist. So Michelle Stansberry, she is a VP of Innovation, and she created this innovation hub within Houston Methodist. And what's unique about that hub is that they actually have to parallel their work, where their full-time job is one thing, but then they also are part of this innovation hub. So when some technology that they want to implement needs to be done quickly, they were already knowing what that innovation is, and they were able to incorporate it in their everyday work, so that when a new technology needs to be implemented, it's not starting from scratch, but they're able to get up and running quickly. So IT is in this innovation hub. She's in this innovation hub. And so when they decided to move forward with DocuSign or Amazon Alexa, it's not a huge lift, but it's something that's more continuous because they're in that role, in dual roles. And she mentioned that that was very critical in helping collaboration. So I think there's interesting insights that you can take both from the public sector side as well as the private sector side around collaboration.
Yeah, I'm glad you're bringing up the topic of quick responses, innovation. So I'd like to pose my next question to Justin. In an IT world where there's continuous advancements, right? Dr. Thompson and Christina both talked about that. How do you find innovative ways to contract with vendors in a contracting space that imposes such strict requirements?
Yeah, thanks. Great question. It's really vital to keep pace with technology, and really, in order to do that, we in the Coast Guard, and I think largely across the federal sector, have really become more flexible and agile in really some of our internal processes, which do include a lot of early and active and extensive engagement with our industry partners, as well as the other federal and military partners, to really understand what's the realm of the possible, what is out there now. It also, on the other side, gives our industry folks a better sense of our goals and requirements. I think some of these clear and concise upfront requirements also helps for a more streamlined evaluation award process. We've also largely worked in integrated product teams across the Coast Guard and really DHS in order to maximize the stakeholder alignment and consensus throughout the program, which has really shortened some of those timelines. And then we've done everything in a virtual environment now with COVID, which is, I think is actually, we've seen some benefit into that. And I think for our Coast Guard Anywhere care program, which is our telehealth solution, I think that's a prime example. As we went from the IPT stand-up in April to getting an RFP released in July and awarding in September, right? So 5 months between kind of stand-up and award. And I think that kind of highlights some of the flexible and agile internal processes that we're taking on, as well as ensuring early and extensive engagement with our industry partners.
Wow, that's incredible. What a win.
That's right.
So Dr. Thompson and Christina, how would each of you chime in from a beneficiary and vendor perspective to the comments that Justin just mentioned? Dr. Thompson?
Well, I think, what he articulated is incredibly important. We very much look to industry for innovative ideas around technology, around business process, workflow. How can we do what we're doing better because of the innovations that our industry partners can bring to the table? You mentioned integrated product teams. We use IPTs quite extensively to bring together diverse groups of stakeholders. And as when we're talking about interoperability and the number of stakeholders in our community that are working towards nationwide interoperability, it's critically important. I think an example of that is our joint health information exchange, which actually got launched last spring in the middle of the pandemic, which moved us from 3 departments having separate endpoints for exchanging data with private health information exchange organizations to a single connection point, which has opened up quite extensively what we're able to do in terms of making data available to our providers on all of the care that they are receiving.
Great.
So innovation is at the core of DocuSign. We were one of the most innovative companies at the beginning in starting an e-signature, and we continue to look to ways to digitize the agreement and process to where just even this year we launched a remote notary and continue to understand ways to make business easier to do. So key to this is really a lot about finding our right partnerships, and we've had some acquisitions. We also continue to push forward on our AI capabilities to be able to help with understanding what are in those contracts. And so when we're looking at our innovation and our portfolio, it's really about how do we then be able to build that trust that our particularly in regulated environments such as the public sector, how are we able to continue to innovate but yet build trust with these partners? Innovation doesn't mean it is something that you have to worry about. So we are we really focus on trust and security and certifications. We made sure that we were FedRAMP and IL4 certified, and we were in compliance with 508, which is to be accessible for the blind and the deaf. So that's one way in which we really try to ensure that innovation is accepted and that we can address strict requirements. Obviously, in the healthcare sector, we have to focus very stringently on Hipaa and PHI compliance. State agencies have put Hipaa BAAs or business associate agreements around so that they can collect confidential information and know that it's secure. We have a no view platform where we don't look into the documents, and these documents are secure. So there's a lot around security and legality that we really focus in on to make sure that our customers' strict requirements are being met, while we're also innovating in the field to make sure that we continue to meet the needs of where we see the industry challenges are.
Thank you. All right, so switching topics a little bit, each of you have touched on the pandemic, right? And I think that we can all agree that 2020 was a year like no other. In healthcare, the healthcare space specifically, the priorities were fully focused on understanding the virus, providing critical care for those affected, flattening the curve, and of course, developing a vaccine. So I'd be curious to know if the challenges brought on by the COVID-19 pandemic changed your initially planned approach at all.
Yeah, so I'll go ahead and start and jump in here. So I think as Mr. Tenson kind of mentioned earlier, we in the Coast Guard had, our planned pilot site rolled out for electronic health records out in California. When really we got in the middle of in the pandemic, and we had to quickly pivot to a almost completely virtual training regimen to ensure the program stayed on track, as well as the safety, obviously, of the men and women in uniform and supporting us through contractors. So I think it's been, I think that's one good example of really shifting and pivoting to a more virtual environment, both working and in training as well. I think too, it accelerated the need for implementation of some of these tools, right? Whether it be telehealth or electronic health records, right? It really brought to the forefront how vital these are going to be getting through this pandemic together.
Yeah, and I'll just build on that. I totally agree with everything you've said, Justin. And, I will say the Coast Guard kind of led the way in moving to a virtual training model, which was adopted by both the DoD and the VA, as the clinical teams on site were really focused on the response. So it did cause a shift in that way, but it also allowed, the work didn't stop. It also allowed a little more deliberate focus on pre-planning for the sites coming up. So it did shift the approach a little bit, but I think there were a lot of positive benefits that came out of it. And I totally agree that it really highlighted the need for modern electronic health record systems with the ability to communicate across beneficiary groups and platforms, and not just across federal agencies, but with our private providers as well. And as I mentioned, during the pandemic, we did launch our joint health information exchange capability. So I think that was a huge benefit.
So COVID-19 really affected DocuSign in accelerating the need to be able to have sort of, in our view, this digital continuum of care. So when you think about the patient journey, and for them to get care, they need to be able to have a more touchless experience now, because going into the office or filling out paperwork and excessive waiting has actually prohibited them from getting the care that they need. And so the way COVID-19 has kind of altered DocuSign's vision is really around being able to help providers and agencies adopt some of these new ways of being more touchless to be able to care for their patients, being able to help with their remote workforce, being able to just do some everyday normal things more digitally and remotely. So we like to think of not only is it around the three main constituents of clinicians and their needs, your employees and your needs, as well as your patients or your service members and their family needs. So that can range from telehealth, HR onboarding, contracting, telehealth. These are all ways in which COVID-19 has really brought about this vision of digitizing for this new normal, as well as providing a touchless patient experience. And I just wanted to also connect to what Dr. Thompson was saying, in that it really has increased the need for us to focus on interoperability because of this patient experience and the need to have this patient record to go across the care continuum. We have invested more in our partnerships to be able to help us be more interoperable. And we particularly are working with the DHA and the VA to be able to help have this electronic record along with DocuSign be digitized. So we are trying to work with them directly to integrate with Cerner's Millennium EHR. And this rollout will take a little bit of time, but once DocuSign and Cerner Millennium are fully integrated, we expect that these service members will have a completely automated process from when they are in service to when they are not in service anymore. And I think this will be very transformative to that experience that they have to be less cumbersome and to get better care, so that their delays are not, so that they want to go in and get care and that they don't see it as a hassle. And I just think we're just going to continue to see these expectations rise because of COVID-19, with all of us being used to having virtual care.
Totally agree with all of you. So we have a very short time left, so I'd like to end our conversation again with the topic of COVID-19 and the pandemic and how we've completely shifted our way forward. What new focus areas emerged in your spaces because of the pandemic? Dr. Thompson, let's start with you.
Yeah, I think one of the key shifts was the increased focus on virtual care. The VA had been doing quite a bit. In fact, they are well known for what they are able to do in the virtual care arena. And I think across the board in industry, we experienced a huge shift from face-to-face to virtual care delivery. The DoD stepped into that, as did many other service providers. So I think if there's one thing from a care delivery perspective that was enhanced because of that, it is that that shift that I don't think is going to go away to the ability to interface with patients in a virtual fashion that we were able to do so successfully.
Thank you. Justin?
Hey, no, I think that's right. And I think just all the enabling tools as well to support. We talked about virtual training and really, a virtual workforce. So all the IT tools to support to make these things happen as well, I think has really been a new focus area. In addition to the more formal, electronic health records and systems, but all the supporting infrastructure IT, I think has been really a focus that's kind of emerged out of this pandemic as well.
So for DocuSign, our two big focuses are really around the patient experience and improving operational efficiency for healthcare providers and agencies. The patient experience is really focused around this touchless experience where you can virtually identify them properly, to getting the consent and Hipaa releases signed and into the EHR digitally, and then within the managing part of your documentation, be able to find what you need and using AI. So that's our overall vision in trying to improve the patient experience. And from the efficiency standpoint, McKinsey estimates that between $280 billion and $550 billion is an opportunity within the healthcare delivery system by 2028. And this is going to mainly be achieved through productivity gains. And we really see digitizing the entire agreement process as being key there. So that is also an area of focus for us.
All right. So we're at time today, but before we wrap up, I'd like to thank each of you for your time and thoughts today. I really enjoyed our discussion. And now I'd like to introduce our next panel topic entitled, Let's Talk Mental Health. Thank you all.